What is the current position in the Rotunda? What are the current restrictions there?
Well, good afternoon, Andrea. Well, first of all, I would like to acknowledge the upset and anxiety and distress that the restrictions do cause on all people, but in particular on patients and their families who use the maternity services. It is particularly difficult, and we accept and acknowledge that for the vast majority of people, pregnancy is not a disease. It's a normal stage of life, and we want to support people to keep it as normal as possible. So it does greatly distress us to have to put in restrictions on visitings and attendance at the hospital. But they're done because of patient safety and to try and minimise the risk of transmission of COVID. And they're particularly important in maternity services because, unfortunately, for many years there has been significant underfunding of capital infrastructure in maternity hospitals. So we're trying to deliver 21st century healthcare in 18th and 19th century buildings. So in the Rotunda, for example, we're the busiest maternity hospital in the country. We have over 10,000 women a year coming through the doors for various services. And what we've done is, as practically as we can, we've tried to put safe restrictions in, but make reasonable exceptions to accommodate patients and their families. So what that actually means is, for routine antenatal visits, where you might have 60 or 70 women sitting in a cramped waiting area, if that suddenly is now 130 or 140 people, because their partners are there as well, the overcrowding is just intolerable. I wish I had a huge waiting area, but I don't.
I understand that, but I mean, is there not some sort of a different roster or rota that could be worked out? I mean, we're all doing that.
The bottom line.
Why not, though, Fergal?
Because the sheer volume of patients coming through. So we've already spread patients out through the day. We now are running clinics in the evenings. We're starting our clinics at 7:30 in the morning. But the volume, Andrea, is so much that does not bring down your numbers.
Okay.
So that, you could have large numbers of people in waiting areas.